Today we're going to be diving into what I believe are some of the most dangerous prescribed drugs out there. Unfortunately, many people taking these medications are never told about the rare but devastating side effects they can cause. And what's more, I've curated this list to focus on common drugs, so it's very likely that you or someone that you care about might be taking one of these right now. For those of you who don't know me, I'm Dr. Josef with During. I'm a doctor and I used to work at the FDA and in the pharmaceutical industry as a drug safety expert. So let's get into it. The first drugs that we're going to talk about are the antidepressants. These are drugs like the SSRIs like Prozac or Lexapro, or even some antipsychotics like Seroquel, which are used for depression, bipolar, and anxiety. Now, while these medications are often experienced as being calming and therapeutic by many, some people will have paradoxical reactions, meaning that they become more anxious or agitated, or in the worst cases, sometimes even suicidal, homicidal, or even psychotic. Now, the internet is full of stories about these drugs being involved in things like suicides and school shootings, and often the most well-known cases involve a drug called Paxil, which is an SSRI. And two notable cases really come to mind for me. One is the case of David Carmichael, who killed his 11-year-old son accidentally during a Paxil-induced psychotic episode. Later on, this case would go on to be dismissed by the Supreme Court of Ontario due to clear evidence that this was drug-related. And the other case comes from close to me. I'm in Utah, but over in Wyoming, one state over, Donald Schell accidentally killed his wife, daughter, and his granddaughter, and then himself when he had a psychotic reaction to Paxil as well. Donald Schell's son-in-law, who lost his wife, actually went on to successfully sue SmithKline for failure to warn about these types of side effects with their drug Paxil. So now let's move on from some of the bizarre behavioral things these antidepressants can do, and we want to talk about another horrific side effect of these SSRI medications, and that is persistent sexual dysfunction. Now, since the SSRIs came onto the market in the late 80s, thousands of people have been reporting that the sexual dysfunction that they developed on the drugs did not resolve after they came off it. And this has recently led to changes in drug labels all across the world. We've had drug label changes in Europe, Australia, and Canada, who are now warning doctors about this risk so they can identify it in their patients. So moving on from some of these serious behavioral problems these drugs can cause, the other thing that I want to mention about antidepressants, they can also cause something called post-SSRI sexual dysfunction. Over the last several decades, thousands of people have been coming forward and sharing that the sexual problems that they developed on these drugs have not fully resolved now that they've come off of them. And some people are even reporting serious cognitive damage from these medications. This has prompted regulators in Europe, Australia, Canada, and Hong Kong to update the labeling on all of these drugs to warn about these persistent sexual problems that are not going away when people come off these drugs. Although this was under-recognized for a long time, finally it's getting some of the attention it deserves, and it has been covered in news outlets like the New York Times recently. The next drugs that we're going to talk about are the ADHD medications. These are drugs like Adderall, Ritalin, or Strattera, and they're used to treat attention deficit hyperactivity disorder in children and adolescents. And honestly, from my perspective, it should not be surprising to people that ADHD medications can cause some severe behavioral problems. They are, after all, mechanistically similar to stimulant drugs like cocaine and methamphetamine. These are drugs that are acting on our dopamine system. However, many people assume that they're not going to have problems with these drugs when they're used at these normal therapeutic doses. But that's not the case. In fact, some people who are just very sensitive to these medications can have side effects, just like the case of Natalie, an Australian woman who spiraled into a drug-induced mania on Ritalin. And when she eventually came off the drug, she looked back and saw what had happened. She had lost her job, she'd lost her partner, she'd lost custody of her 2 children, and she had burned through $120,000. Now, there have been thousands of cases just like Natalie, and the risk of these behavioral problems are now at least widely recognized by regulators, and they are present in the drug labels, where it talks about the risk of psychiatric adverse reactions, including the risk of inducing new psychotic or manic symptoms in some people. The next drug on the list is aripiprazole, also known as Abilify. Now, this is an antipsychotic medication, but it's also very commonly used as an antidepressant. For many people, this is a popular antipsychotic to take because it's associated with less weight gain and less sedation compared to some of the other drugs. And that's because it's a partial dopamine agonist. And I want you to remember that because most antipsychotics block dopamine. And when something is a partial dopamine agonist, that means it can actually stimulate that receptor sometime. And what do we know about stimulating dopamine receptors? Well, it's associated with things like compulsive behavior, addictive behavior, and sometimes things like disinhibition. I mean, those dopamine receptors is where drugs like cocaine and methamphetamine really act on. And that point is going to be important for this. So since Abilify has been on the market